My name is Angel Guy. I'm a registered nurse. I've been a nurse for 5 years, and my specialty includes critical care and step down, which is kind of the in between the regular floor and critical care. Typically my work day starts at 5 a.m. I get myself ready, and then my daughter ready, and then I drop her off at my mom's house. Then I take about a 10-minute drive to work, and depending on the facility that I'm scheduled to work at, I'll either change into the hospital issued scrubs, or I dress out in full PPE, and I remain in full PPE unless I'm taking a break or going to the restroom. I get a report for my patients, I check my orders, and then I like to cluster my care. So I do like multiple things at one time to kind of limit my exposure to the COVID patients. I spend the rest of my day documenting, carrying out orders, traveling for tests, etc. I do that like over the course of 12 plus hours. And sometimes I get busy where I don't have the opportunity to take a break or even use the restroom. Sometimes I'll go just about the whole shift and then realize that I didn't even take a restroom break that day. So sometimes we do get extremely busy. And we take on different roles and hats as nurses on the COVID unit. We learn to be environmental services, keeping the room tidy for the patients. I also have to be the phlebotomist where we draw blood and other different titles that we wear, and that can be tiring, both mentally and physically, because we don't have the adequate staff that we need to help maneuver patients, move them and lift them. And we also have a nursing shortage because nurses left to either travel, got sick themselves, or they quit. So physically draining because we have to do a lot of the work ourselves, mentally draining from what we see day in and day out. And what we have to deal with. I think one of the biggest roles that we play outside of being a healthcare provider and a member of the healthcare team is the role of like family and friend to the patients, because they see our faces as the nurse most. They aren't allowed visitors to limit exposure. So the nurse is the person that they see and interact with the most. And for some patients, the nurse is the last voice that they hear and the last face that they see before they pass on. A lot of hospitals are now allowing nursing students to come back into the clinical area. During the time of COVID, they had stopped nursing students from being able to come to the clinical sites, so they got most of their training virtually versus a hands-on experience. So a lot of these nurses are going out into the field of nursing with limited or lack of hands-on personal experience with patients, and that can be a little bit scary. I not only have to worry about myself exposing my family and my young child to COVID, but I also have to worry about my husband, who's also a frontline worker. He's a firefighter paramedic. I also have to worry about him exposing our 1-year-old child to the virus. So that can be stressful at times as well. And I also try to set limits or boundaries. I try to leave work at work and leave home at home, so I can create kind of a work-life balance when I'm off work to kind of reset, recharge, and stay grounded. I like to relax at home, take long baths, just to kind of ease my mind and take it off of things that are going on at work. And I like to spend time with my family. I think I value family time even more now than in the past, just because so many people have died from COVID or lost loved ones due to COVID. I think a common misconception about COVID is that it's an older person's disease. COVID it's not geared towards a certain population or age or race or ethnicity. No one is off limits from it. I think everyone is susceptible to getting COVID. I think COVID presents itself differently to everyone. It's not presented the same. Some people can be diagnosed with COVID with or without symptoms, and those who are diagnosed without symptoms can still spread the disease to other people. That's why I think it's important for people to wear masks while in public to protect themselves as well as others, and also to self-quarantine when necessary and practice social distancing. I also think anyone that wants to go into the nursing field, you have to have a passion for nursing and helping other people. It's not always a pleasurable experience, but it is a rewarding experience at the end. So you have to remain positive and just remember that there is a light at the end of the tunnel. And I think COVID can have a lasting effect on some people. They still deal with respiratory issues. A fellow colleague who was diagnosed with COVID prior to COVID, she was able to wear a mask for 12 plus hours without any issues, versus now she can't wear a mask for a long period of time without feeling like she's suffocating. I've heard of people that now require like supplemental oxygen, who didn't require oxygen before being diagnosed with COVID. I've also had a patient who was fairly young, probably like mid-30s, who was diagnosed with COVID, who would always tell me he wanted to get better in order to get back home to his younger child. And unfortunately, the disease caused respiratory complications. The patient ended up with a breathing tube and eventually died as a result of COVID. I think a lot of people think that COVID isn't real, but I think if they could see it from my perspective, and see the patients that are actually in the hospital struggling, fighting for their lives because of the disease, they will have a different outlook on it. It's very real and it's scary when it gets to that point, and especially even those that overcome COVID and still have to deal with the respiratory issues from COVID, you know. So I think you should take it seriously and make sure that you practice social distancing again and wear your mask, because it's very real.